Medicaid.
Yeah. But they're not necessarily poor or homeless type of people, right? They're middle income families, but they've either spent down or they were smart enough to sort of move their assets to their kids, and so they could qualify for Medicaid.
In other words, they have to show that they're poverty level to get the Medicaid.
Yes.
Right.
Yes.
And
coverage.
Exactly.
Yeah.
And so in the old days, people used to just dump their assets really quick. And Medicaid kind of caught on it. So there's a 5-year look back now.
Oh.
From the day that you try to get rid of all your assets, they won't cover you for 5 years until...
Wow.
So the trick is for all of you older folks out there is transfer all your assets to your kids now. Right?
So that's something that attorneys are probably advising a lot of families. The problem with that, I feel, in my personal opinion, is, once your parent loses the title to the house, then some kids may be more likely to, just put them in a nursing home.
Yeah.
You lose your only leverage, right?
Yeah.
So it's tough.
It's interesting.
Yeah, most people want to stay in their home.
Of course.
But it becomes very costly because paying home health aides, that can range, I think the agencies are $40 to $50 an hour for a home health aide. Cash payment would probably be $25 or so, if you're just doing it with a neighbor or somebody like that.
Yeah.
But that runs up to $30,000, $40,000, a month if you have 24-hour caregivers. So.
Yeah, so it's cheaper to be in a nursing home if you're going to do 24-hour caregiver at home.
Wow.
Right?
Yeah.
So who can afford that, right? Long-term care insurance, or you've got money.
So I think that's the important thing about screening for memory issues early on, so that
you can
so that we can recognize that, and everybody should be doing their just their advanced healthcare planning, but financial planning. And one thing I would like to emphasize is the importance of having a financial power of attorney.
Oh.
We should all have that, because just because you're married to somebody doesn't mean you can manage their finances, right? So even a husband and wife have to designate the other. So, but what we often see is somebody comes in with advanced dementia. They don't have a financial power of attorney, so nobody can pay for their care, right? And they can't sign. They're not able to sign a document any longer to hand over that power of attorney. So,
and I think the point about like people who have the benefit of having education, right? They generally do seek out advice on things like long-term care, right? Because if you're a little bit more educated and you're a little bit more savvy about what's going to happen, you are going to look into things like long-term care or power of attorney, or like a legal guardian or whatever it is, right? But I think some people don't even know that that's available or that exists, right? They're not even thinking that way.
I mean, you would think so, but I mean, I do have many 90-year-old patients that live alone, and one day they end up in a hospital and they don't get back to where they were, their baseline, and then their kids are like, wait a minute, what's happening? Mom was...
Right.
She's 92, but she was living alone. She was doing her own groceries. She was driving. And how come this happened suddenly? And we don't understand, right? They expect that she'll just bounce right back. And so they haven't planned.
Right.
Yeah. But what I'm saying is that I would say if you looked at just the general population, right, the people with more education are going to be a little bit
more prepared.
Right? They have friends who, hey, you guys got long-term insurance, and you know what I mean. It's kind of one of those things.
We hope so, right?
Yeah, we hope so. But you're right. Not everybody will do that, and I think you brought up a good point. Is that I think a lot of kids, a lot of people who are not in the medical field, I think they just think that somehow we doctors are going to be able to cure their mom and dad and fix them to like they are. So like in the case of hip fractures, right? People think, oh, my mom fell down, I had a hip fracture. You're going to do surgery on her and she's going to be like she was before. And I always tell them that, I hate to break it to you, but, mom's really, you're very, very lucky if mom is near what she used to be, because the hip fracture is just a sign that, it's that downhill slide.
You guys remember in medical school, one of the first things they taught us, and it sticks in my head, is the 5-year mortality
Mortality
after a hip fracture.
Yep.
And
The 1-year mortality
Yeah.
after hip fracture.
And I thought,
What is
I don't
that?
understand
It's like
that.
30
you know?
to 50%.
Yeah, but it's
But it sticks in your head, right? That
It
the
sticks in your
mortality
head, right?
goes way up.
and it's because of exactly this, right?
Yeah.
And so when I talk to families that are in that situation where, oh my God, my 92-year-old mom just broke her hip and she's not bouncing back like I thought, and we have these discussions, I always tell them, hey, this is a good opportunity for you to start planning your own future
Yeah.
Right.
with your
Good point,
children.
yeah.
you know?
Yes.
Because someday you might
This
be
is
in
gonna
this
happen to
position,
you.
right?
Right.
The inside joke for us is be nice to your kids because they're going to choose which nursing home you're going to go to.
Right.
Right?
Yeah.
I mean, that's really the worst case scenario that you sort of need to plan for. Yeah.
I have a selfish question, Dr. Price, because I have so many patients, women mostly, on hormone replacement. Is there any connection with estrogen or hormone replacement and either prevention or lowering the risk of anything? As far
That
as
question came up last week with our talk. They've done a number of studies with estrogen and cognitive function, and there's no set answer, really. It's not showing a benefit, really.
Got it.
Yeah.
What about testosterone replacement for men?
I don't know about that.
Well, I think I was just going to say for estrogen and testosterone, it may not delay dementia, but it may address the muscle part you're talking about, right?
Right,
The
right.
lower
And the
extremity
activity.
strength. Yeah, and activity is a large piece of the pie.
Right.
So in that respect, it may help keep you independent longer, or it may help keep you in the home longer, not necessarily stave off dementia. But like we talked about earlier before we started this, Dr. Price and Dr. Shu had given a talk about dementia to our colleagues last week. And it used to be people would ask us, hey, what's the purpose in finding out early dementia if we don't really have good treatment for it? But now we do.
Oh, yes.
Right?
Can you let us know
And
about some of those
I don't know
treatments?
if you,
that,
Actually, I was just going to ask that.
yeah.
Is there any treatment, effective treatment for dementia? So maybe we can talk about that as a subject now, since you brought it up.
So the answer is complicated. We have a number of medications that we've used over the years, including Aricept, memantine, rivastigmine, that sort of thing. Those were approved because they showed a decline in the rate of decrease in cognitive
So it
function.
slowed
it
the
down.
cognitive decline.
Right. But they didn't study it very long term, so those drugs. So that's all we've had to use. But
anecdotally, did you guys see improvement with those drugs?
it
Maybe
really depends.
behaviors, maybe?
Yeah, so it really depends on the patient. I normally don't start a 95-year-old
Right.
on those medications because they have side effects.
I think like Aricept, I think maybe some help in Lewy body dementia and hallucinations.
Right, so
yeah.
they can be used for behaviors. But there have been a lot of advances in the past 10 years or so. And the medication that Al was talking about is lecanemab, which is an antibody treatment that removes the plaques and tangles from the brain. So I think...
How is that administered? It's an IV?
It's an IV. You do it monthly, every 2 weeks. And I can't remember the duration of the therapy, but
There's two
basically
now.
it kind of sucks out those
Wow.
proteins. And so there have been a number of different, similar medications.
You mean it actually decreases the protein
The
that
tau protein.
that causes or
is associated with
is associated with dementia. So it's possible that this could actually reduce dementia or reverse a little bit of the effects that.
Right, exactly. The clinical effects, right? So
That is amazing.
because people
But it's
can
not approved by FDA yet.
no, it is,
It
but
is.
it, but
Oh,
it's,
it is.
it's only it's only for Alzheimer's disease.
For mild.
Oh,
early.
mild.
Early, so mild cognitive
okay.
impairment and early stage Alzheimer's disease.
Wow.
It requires a big workup, including a spinal tap and CTs and all sorts of things. There are risks associated with that, some brain swelling and bleeding. So you have to monitor it very, very carefully. But these things are being developed, every day, and so the hope is that we'll be able to treat dementia just like any other chronic illness, diabetes or hypertension, as these therapies become available.
Yeah, I mean, I think it's exciting because we've not had hardly anything that it was hard to answer that question, right?
Right.
Why do you want to know early? Well, you want to get your finances in order and you want, that kind of stuff, plan for the future. But now we actually have something, it's not perfect, but it's the first step in a long time that we've been, able to, and Dr. Price said, those proteins are associated with dementia, so we don't really know cause and effect.
In other words, the proteins are there, but we're not sure if it actually is what's causing dementia. It is definitely something found with patients that have dementia.
Exactly.
Got it.
Right. Yeah. And so it I believe it reduces the protein. I mean, I listened to your guys talk, like 71 to 80%.
Wow.
And it removes the ones that are in solute, I guess, in solution, and that creates the hard plaques will start to melt.
Yeah, it's basically
That's amazing.
It's like it's chemistry, right? If you reduce it, then you can have more dissolution of crystal, right? Yeah.
Exactly,
so to speak.
Yeah. It's that's exactly what it is.
Yeah.
But it's exciting for us, I think.
Yeah. Let's just to recap. So the treatment for Alzheimer's include medications like Aricept.
Mm-hmm. Yes.
What was the other one that you mentioned?
Memantine
and any others?
Rivastigmine.
Rivastigmine.
Yeah. Or Exelon, that's a brand name.
Exelon.
Right?
Okay.
Aricept is a brand name.
Okay.
But that's about it, really. Yeah. I mean, there's
and
not a lot.
then this infusion, which was what again?
Lecanemab is
okay. Is there a simpler name that people might recognize?
Leqembi.
It
Leqembi
Like
is the trade name.
Yeah. Oh, like life can be.
Leqembi.
The drug companies really need to do a better job naming these things.
Really?
I would have named it Memory Be Gone.
Memory come back.
Or Forget No More. You know what I mean? Something like that, right?
Yeah. There's
Who can remember that?
There's
You don't have to.
There's 2 infusions that are out now. So I don't remember what their names are, but they're very similar. I think one is given a little less frequently and is a little bit more effective, sounds like.
Interesting.
The neurologists are sorting that all out.
Mm-hmm.
That's amazing.
So we're giving it at Straub.
Oh, you guys are currently?
We do, yeah.
Wow. Are there any, is Straub part of any kind of clinical research study regarding this medication or anything that you know of?
No, there's research at the Pacific Neurosciences, but we're not participating in a study that I know of. But,
no, it's FDA approved already.
But it's not paid for by.
That's the other thing. These lovely drugs come out,
right?
But how much is insurance covering?
Upwards of $30,000 a year.
Oh my goodness.
Yeah.
But compared to, nursing home or the consequences of eventually down the road, it might be worth it.
If we can stave off dementia long enough that you die from something else, right? I mean, that's the goal, I guess, right? I don't know if cure will happen or not, but if we can delay it, right?
Mm-hmm.
And then that's assuming your body
holds
stays
up.
right there, because like we talked about before, people don't realize how important mobility is for older folks. Once you lose your mobility, you're done, right?
Yeah.
I mean, that's the way it is. That's the whole reason we fix hip fractures, is to get them back up on their feet.
Right.
So I think that's really important. Gosh.
Now that you mentioned mobility, I just want to put a plug for geriatrics. We focus on 5 different things. So memory, mood, because depression is very common. Mobility is another one. Medications, because there are a lot of medications that can increase risk of falls and other things. And then multimorbidity. So a lot of these patients have many different medical problems, and they're all sort of superimposed upon, maybe dementia or a mobility issue or so forth. So paying attention to those 5 things is kind of a good way of framing.
Sorry, the 5. It's like, what did you say? 5 M's.
Well, they call it the 4 M's.
The 4 M's.
But I just use those 5 for myself. So memory, mood, mobility, medications, multimorbidity.
And multimorbidity. Multimorbidity, like, for example, trying to make sure your diabetes is well controlled.
Right.
Or other things, right?
Well, if somebody has congestive heart failure and cancer and this, that, and then they have dementia as well. So managing those things is more complicated, I think, as we get older.
In fact, just you were talking about the screening process, right?
Right.
And I think it's important, like she talked about, because mood, a lot of older folks are depressed, right?
Yes.
And there's a lot of reasons to be depressed. All your friends, and you're losing your independence, and sometimes an antidepressant may help reverse that sort of memory loss. And there are reversible causes of memory loss, and it may not be Alzheimer's, right?
That's a good point.
It could be a thyroid problem or a vitamin B12. Remember
other organic things going on.
Yeah, so that's what she was talking about. When you kind of got to work it up, make sure it's not these other reversible.
So what are, maybe if you can go over that a little bit, what are some of these common things associated with reversible memory loss? You said vitamin B12 and
thyroid.
And
yeah, so I mean, it can be just delirium, right?
Polypharmacy.
Meaning they have too many meds that they're on.
Too many meds that they're on. They don't necessarily need to be